Why do your legs go numb and tingle every night while you sleep? Most people blame the mattress, or the pillow, or one strange sleeping position. And sometimes, that is exactly what happened. You placed pressure on a nerve. The signal became distorted. You moved, the pressure disappeared, and the familiar pins and needles feeling faded away. But when the same sensation returns night after night, it may be more than a harmless sleeping mistake. Because numbness and tingling are not random. They're messages. Messages created by nerves, blood flow, muscles, joints, and the brain. And the strangest part is this: the problem may not begin in your legs at all. It could begin in your lower back. It could come from a nerve trapped near your hip or knee. It could be linked to blood sugar, a vitamin deficiency, circulation, or a condition that becomes easier to notice only when the world goes quiet. This video is for education, not diagnosis. Persistent, worsening, or new numbness should be discussed with a qualified medical professional. Before we go deeper, answer one simple question. Does it affect one leg or both? Type 1 or both in the comments. And subscribe, because ordinary symptoms often hide extraordinary biology. Let us begin with the most common explanation. Pressure. A nerve is like a living electrical cable. It carries information between your body and your brain. Touch, temperature, pain, pressure, movement. Now imagine placing a heavy book on a charging cable. The cable may not break, but the signal may weaken or become unstable. Something similar can happen when your body weight presses on a nerve for too long. You may sleep with one leg crossed over the other. You may keep your knee sharply bent. Your hip may rotate inward. The edge of the mattress may press behind your knee. A tight blanket may hold your foot in an awkward position. Any of these can irritate a nerve. At first, you may feel nothing. Then the area becomes numb. When you finally move, the signal returns in a chaotic burst. That is the prickling sensation people describe as pins and needles. For an occasional episode, this is usually not alarming. But repeated symptoms are different. Night after night means a pattern is forming. And patterns deserve attention. But pressure near the leg is only one possibility. The next suspect is the spine. Your feet do not send signals directly to the brain through empty space. The information travels along long nerves, enters the spinal cord, and rises toward the brain. Think of your spine as a protected central highway. Nerve roots leave that highway through small openings between the bones. If one of those roots becomes compressed or inflamed, the brain may feel the problem farther down the leg. The source may be in your back. The sensation may appear in your thigh, calf, ankle, or toes. A disc may bulge. Arthritic changes may narrow the space around a nerve. Inflammation may irritate a nerve root. A certain sleeping position may increase pressure. Another position may reduce it. This is why some people notice tingling only when lying on one side, bending the hips, or sleeping flat on the back. People often think an irritated spinal nerve must cause severe pain. Not always. It can create numbness. Burning, buzzing, a cold sensation, a warm sensation, weakness, or a feeling that the leg does not fully belong to the body. The location can provide clues. Symptoms traveling from the lower back through the buttock and down the leg may suggest one pathway. Tingling only in the toes may suggest another. Numbness on the outer thigh may involve a different nerve from numbness under the foot. Doctors sometimes map these areas because nerves follow recognizable routes. It is like investigating a blackout. If only one row of houses loses power, the pattern helps reveal which cable failed. Have you noticed that changing your back or hip position changes the tingling? Type yes or no. Now we need to separate true numbness from another nighttime problem. Restless legs syndrome. This condition can cause crawling, pulling, buzzing, itching, aching, or electrical sensations. But its most important feature is usually an urge to move. The discomfort begins or worsens during rest. It becomes stronger in the evening or at night. Movement brings temporary relief. Walking may help. Stretching may help. Shaking the legs may help. Then the sensation returns when the body becomes still again. That is different from a leg that remains numb no matter how much you move. It is also different from a muscle cramp. A cramp is a sudden involuntary muscle contraction. Restless leg syndrome is more like an internal command that says, move now. The description matters. Numb means reduced or absent feeling. Tingling means prickling or buzzing. Burning often points toward irritated sensory nerves. Crawling may fit restless legs. Cramping suggests a muscle tightening by itself. Those words are not minor details. They help separate different mechanisms. Now we reach one of the most important possibilities. Peripheral neuropathy. Peripheral nerves are the nerves outside the brain and spinal cord. They connect your central nervous system to your skin, muscles, hands, feet, and internal organs. The longest nerves in the body travel all the way from the lower spine to the toes. Their length makes them vulnerable. Imagine maintaining an electrical cable that runs across an entire city. Damage can occur to the wire, to the insulation around it, to the tiny blood vessels feeding it, or to the repair system that keeps it working. When peripheral nerves are damaged, they may send signals when nothing is touching the skin. They may fail to send signals when something is touching the skin. Or they may send a distorted version of reality. A soft bedsheet may feel painful. A warm floor may feel strangely cold. The feet may feel as if they are covered by invisible socks. Tingling may begin in the toes and slowly move upward. Why can neuropathy feel worse at night? One reason is attention. During the day, your brain is busy. You are moving, talking, looking at screens, solving problems, and reacting to the world. At night, those distractions disappear. A faint internal signal suddenly becomes much louder. It is like hearing a quiet clock only after everyone leaves the room. Night may not be creating the problem. Night may simply be revealing it. One major cause of peripheral neuropathy is diabetes. High blood sugar over time can damage nerves and the tiny blood vessels that supply them. The feet are often affected first because the longest nerves are usually the most vulnerable. But diabetes is not the only cause. Vitamin B12 deficiency can affect nerve function. Thyroid disorders may contribute. Kidney disease can allow waste products to build up and irritate nerves. Autoimmune conditions may attack nerve tissue. Certain infections, inherited disorders, injuries, and medications can also cause neuropathy. This is why guessing can be dangerous. The same tingling sensation can come from very different problems. And each problem requires a different response. Random supplements are not a reliable solution. The goal is not to silence the symptom blindly. The goal is to understand what is producing it. Before we move into the more urgent warning signs, subscribe now. Not because every tingling leg is dangerous, but because knowing the difference between harmless pressure and a serious signal can change what you do next. A medical professional may begin with questions that sound extremely specific. When did it start? Did it begin suddenly or gradually? Does it affect one leg or both? Does it start in the toes? Does it travel from the back? Does walking make it better? Does lying still make it worse? Is there pain? Weakness? Swelling? A change in skin color? Loss of balance? Do the symptoms disappear after moving, or do they remain? A physical examination may check strength, reflexes, balance, pulses, and the ability to feel vibration, temperature, or light touch. Blood tests may look for diabetes, vitamin deficiencies, thyroid problems, kidney problems, or other conditions. If a compressed nerve is suspected, imaging may be considered. If nerve damage is suspected, doctors may use nerve conduction testing or electromyography. A nerve conduction test measures how efficiently an electrical signal travels through a nerve. Think of it as checking the speed of data moving through a cable. Electromyography studies electrical activity in muscles. It can help show whether a problem begins in a nerve, a muscle, or the connection between them. Now let us talk about circulation. Poor circulation is often blamed for every numb leg. But true blood flow problems usually create additional signs. A foot may feel unusually cold. The skin may look pale, bluish, or different from the other side. Walking may trigger calf pain that improves with rest. A wound may heal slowly. The pulse in the foot may be weaker. Problems with veins more often cause swelling, heaviness, aching, or visible enlarged veins. A blood clot in a deep vein can cause new swelling, warmth, pain, or discoloration, usually in one leg. Tingling alone is not the classic pattern. But sudden swelling or pain should never be ignored. Now imagine something more serious. You wake up with tingling in both legs. You stand, and one foot does not lift normally. Your balance is poor. The weakness is increasing. That is no longer a simple pins and needles story. Progressive weakness suggests that the nerves are not merely sending strange sensory signals. They may also be failing to control movement. That requires prompt medical assessment. There is also a rare but dangerous spinal emergency involving severe compression of nerves that control the legs, bladder, bowel, and sensation around the groin. Warning signs include worsening weakness or numbness in both legs, numbness around the inner thighs, buttocks, or genitals, difficulty urinating, loss of bladder control, or loss of bowel control. These symptoms require emergency care. Sudden numbness on one side of the body can also be a warning sign of stroke, especially when it appears with facial drooping, arm weakness, speech difficulty, vision changes, dizziness, or loss of balance. Stroke symptoms usually begin suddenly. Even if they improve after a few minutes, emergency help is still needed. Other urgent signs include rapidly spreading tingling with increasing weakness, numbness after a major injury, or a leg that becomes pale, cold, extremely painful, and difficult to move. Chest pain, fainting, or shortness of breath combined with leg swelling also changes the situation completely. So, what can you safely observe before a medical appointment? Start with timing. Write down when the sensation begins and how long it lasts. Does it wake you from sleep? Or do you notice it only after waking? Record the exact area. The whole leg? The outer thigh? The calf? The sole? Only the toes? Notice whether movement stops it. Notice whether changing position helps immediately or only after several minutes. Pay attention to back pain. Look for swelling or skin changes. Notice weakness, stumbling, or poor balance. Also record medications and supplements. Choose the word that fits your sensation best. Numb, tingling, burning, or crawling. Type just one word in the comments. For occasional position-related tingling without warning signs, changing sleep posture may help. Avoid sleeping with one leg heavily crossed over the other. Try not to keep the knees sharply bent for long periods. Make sure clothing and bedding are not unusually tight. Gentle daytime movement may support mobility, but nightly symptoms should not be managed only by rearranging pillows. A mattress cannot correct every nerve problem. Stretching cannot solve every spinal condition. And supplements cannot replace proper testing. Treatment depends on the cause. A compressed nerve may improve with activity changes, physical therapy, medication, or, in some cases, a procedure. A confirmed deficiency may require targeted replacement. Diabetes-related neuropathy requires management of blood sugar and careful protection of the feet. Restless leg syndrome may require evaluation for iron deficiency, medication effects, or another health condition. Peripheral neuropathy may require treatment of the disease damaging the nerves, along with strategies to control symptoms and prevent injury. Numb feet create a hidden danger. When sensation is reduced, a person may not notice a blister, cut, burn, or pressure wound. Pain is not the only measure of seriousness. Sometimes the lack of pain is exactly what creates the risk. And here is the twist. The tingling that keeps you awake may not mean your body is failing to communicate. It may mean your body is communicating as clearly as it can. Your nervous system has no spoken language. It cannot say, "A nerve is compressed behind your knee." It cannot announce, "The insulation around this nerve is damaged." It cannot place a warning symbol above your spine. Instead, it changes sensation. Buzzing, burning, numbness, pins and needles. The message feels vague because the brain is receiving distorted data. But the pattern around the message can be precise. One side or both. Toes first or thigh first. Worse during rest or worse during walking. Relieved by movement or unchanged by it. Linked to the back or isolated in the feet. Sudden or gradual. Stable or spreading. Those details transform a strange feeling into useful medical evidence. Night reveals something deeper about the brain as well. We imagine sensation as a direct recording of reality. But what you feel is an interpretation. Your skin detects a stimulus. Your nerves encode it. Your spinal cord relays it. Your brain reconstructs it. At every stage, the message can change. A damaged nerve may make soft touch feel like burning. A compressed nerve may erase sensation completely. A restless neurological circuit may create an intense urge to move even when the muscles are healthy. The feeling is not happening only in your leg. It is being created by a conversation between the leg, the spinal cord, and the brain. And when that conversation becomes distorted every night, the timing becomes part of the message. So the next time your leg begins to tingle in the dark, do not immediately panic. But do not automatically dismiss it. Move. Observe. Notice the location. Notice the duration. Notice what makes it better. Arrange a medical evaluation when the symptom keeps returning, worsens, spreads, or affects strength and balance. Seek emergency help for sudden one-sided numbness with stroke signs, severe or worsening weakness in both legs, numbness around the groin, loss of bladder or bowel control, or a suddenly cold, pale, severely painful limb. And subscribe, because one unexplained symptom can open a door into the hidden engineering of the human body. Your legs may feel as if they are falling asleep. But the real question is this: what is your nervous system trying to wake you up to notice?